Time for this morning's Healthy Living, and new numbers show a huge spike in type 2 diabetes among kids. According to research from the National Institute of Diabetes and Kidney Disease, the number has jumped 95%. Adults are also seeing a spike. The U.S. Preventive Services Task Force has lowered its recommended age to 35. That's down from 40. To test people with above normal BMIs for elevated glucose levels that could mean prediabetes or diabetes itself. Overweight and obesity are the strongest risk factors for developing prediabetes and type 2 diabetes in adults. Dr. Lina Huerta is a pediatric endocrinologist at Penn State Children's Hospital, and she says she's not surprised by these numbers and is urging a response from the community.
If we don't fix this child with prediabetes, and that means elevated hemoglobin A1C, impaired fasting glucose, dysglycemia, a child who was an infant of diabetic mother that is jumping on the growth chart for 10 years without any way to stop that curve. And we need help. If we really want to have more adults if we want to have adults, first of all, because unfortunately type 2 diabetes is also a cause of mortality, not only morbidity, but also mortality.
As Dr. Huerta mentioned, there are several factors that put a child at a higher risk of developing type 2 diabetes, and we have those on our website, abc27.com, under the Healthy Living tab. In addition to knowing your risk factor, Dr. Huerta says education is key. She'd love to see more resources for education on nutrition and healthy eating within schools, and says physical activity and daily movement has to become mandatory for our kids.